Related kidney diseases have become a burden in most Kenyan homes, a pain that hurts every member of the society, especially when it comes to raising funds for their loved ones to get the care they need. We highlight the cost of kidney treatment in the country and the burden Kenyans have to bear. My name is Belden Walyaula.
Life was good, very good when I did transplant, because now I got my peeing back, because when you get kidney failure, you lose your urine, you don't pee.
Teresa Wangari recalls her life soon after her first kidney transplant in 2011. She lives in Kiambu, Tinganga area, and she has had chronic kidney disease for the last 12 years, since 2009.
Hatarini. Niligonjeka after form 4 baada ya kumaliza KCSE. I just stayed for 1 year. That was in 2009.
From here, she was to start on dialysis without fail. But after a while, her family thought that a kidney transplant was the best option if young Teresa was to get a second chance at life, to live an almost normal life, and to realize her full potential.
In 2011, that's when I did my transplant.
But her hopes and dreams were dimmed in 2015 when the transplanted kidney failed. She had to go back to dialysis to live.
Because of the expense. You know, when we were planning for transplant, we didn't know that we'll be forced to go back to our pockets for the drugs. We didn't know, actually. In 2013, I lost my mom. She passed. She was the one who was taking care of me because dad was still old, and mom was a teacher. And teachers don't earn a lot of money ati anaweza afford hizo dawa. So when she passed in 2013, for 2 years I struggled to get those drugs, because even my siblings wako na makwao wanasaidia, na utashinda ukiomba watu kila wakati kushinda ukiomba. It's a very expensive disease.
Due to lack of this medicine that would ensure that her body does not reject the new kidney, she was back to where she started, dialysis. This, she says, was the toughest moment of her life.
I could not imagine myself back to those machines. And what consoled me is that people were willing to help and give drugs, because I remember I told my dad, sasa utauza nini? Unless sasa tushinde tukiomba na watu watakubali kutusaidia all that long. And maybe I gave myself, I even told my dad, I'm giving myself 2 years. Then unitafutie unizike tu karibu na mom, kwa sababu I know you have tried. Dad, you have tried. My sisters have tried. And even the society has tried.
Maureen's story is similar in many ways to Teresa's, but with a better outlook. Maureen is now 34 years. She lives and works in Rongai, Kajiado County.
By that time, my kidneys had failed. It was at stage 5, so it was beyond repair. The options that I was given were either to do dialysis for life or to do a transplant.
This was in 2015 when she was diagnosed with lupus, which affected the functions of her kidneys. She survived on dialysis for 2 years before her brother donated his kidney to her.
Initially, I used to use 50,000. That is immediately after surgery per month. It came as a shock. I was not prepared for that. But it came down. Right now, I'm using 30,000, but it's still a lot. Imagine having to part with 30,000 shillings per month, like from wherever. So
Maureen lives in fear of not being able to afford the immunosuppressants that keep her kidney alive and working.
So in my case, my family and friends come through for me, but it's not normally very easy to ask for assistance every now and then, because some people may not understand. They see you like you're okay, you're fine.
Globally, kidneys are the most transplanted organs. In 2019 alone, in 7 different hospitals in the country, including Kenyatta National Hospital and Moi Teaching and Referral Hospital, approximately 163 kidney transplants were done. The biggest challenge, however, for the kidney specialist is not whether the transplant can be done, but whether the recipient can maintain the new kidney and avoid rejection through the lifelong medicines known as immunosuppressants.
When we look at 2018 and 2017, the young people who came back from transplantation dialysis did so because they could not afford medication.
Before a transplant is carried out, tests have to be done to ensure the donor is fit and compatible with the patient before they donate. One is started on immunosuppressants even before the transplant is done. These medicines are the gap between the kidney working or restarting dialysis.
We try to ensure that those patients who finally get kidney transplantation are able to afford. So we will probably not take in a person who will demonstrate that they cannot be able to afford medication post-transplantation because the kidney might be rejected too soon.
Samuel Mugo, who owns a barber shop and a cyber cafe in Gatundu town, understands intimately the challenges of keeping a kidney alive.
We have done like 5 fundraising to get to the transplant. But God is good. I did a successful transplant at Kenyatta National Hospital.
COVID-19 has hit his business hard, making life unbearable with the little income he earns. Before doing a kidney transplant, he did dialysis for a period of 9 months until his brother offered to donate one of his kidneys to him.
Kwa mwezi natumia karibu 18,000 to 20. Kama mimi nimekuwa nikiombaomba na kufanya fundraise hiyo ili kupata hiyo mandawa. Juu family imecontribute karibu kila kitu sasa. Most of the Fred wamechoka kutoa.
The major risk of a kidney transplant is the body rejecting the new kidney. This can happen if your body's immune system realizes the kidney is foreign. To prevent this, one must take medicines to weaken the immune system. These medicines are required for as long as the new kidney remains viable and in use, basically for the rest of one's life.
The cost is prohibitive, costing around 45,000 per month for the first 6 months. Then of course the cost comes down as reduced immunosuppression. Many of them cannot afford. In any case, NHIF, despite coming out and supporting the transplant through some funding, has not come out to support immunosuppression medication.
The cost of immunosuppressants for an average middle-class household, let's say with a monthly income of 100,000 shillings, is prohibitive and unsustainable.
Because imagine losing a kidney which someone gave you because of drugs. It's just like a waste. In fact, most people are refusing to do transplants because of that. The cost that they will incur when they do transplant.
This is one of the wards here at Kenyatta Hospital where dialysis takes place. Normally, a patient must take at least 3 sessions a week, but here in the country, patients only take up to 2 sessions because of the cost. When one has end-stage kidney disease, their kidneys are unable to perform their tasks and they require renal replacement therapy in the form of dialysis or kidney replacement through a transplant. Specialists say the number of patients going back to dialysis after getting a kidney transplant is worrying and quick action is needed.
In terms of percentage, we have got like between 15 and 25% of the patients who have transplanted every year will come back in one form of rejection or another.
NHIF caters for 2 dialysis sessions a week. This is not enough to cater for the needs of a dialysis patient. At some point, they still have to dig deep into their pockets. One dialysis session costs 9,500 shillings. In a week, NHIF parts with 19,000 shillings. In a month, an equivalent of 76,000 shillings. Therefore, amounting to almost 1 million shillings every year.
When NHIF pays for dialysis, people then tend to imagine that dialysis is free. So it creates a disincentive such that persons would rather not do kidney transplantation, rather would continue with dialysis. And it makes sense for them. I don't blame them. However, it is nice for us to remind people that transplantation is much more better, offers better quality of life.
NHIF, however, does not cover the pre-transplant preparation tests, some which are not done in the country. Add the costs of post-transplant care, and it becomes an uphill task to many Kenyans living with the end-stage kidney disease who would have benefited from a transplant. They then end up staying on dialysis on the basis that its costs are covered.
So we had to pay. It costed around 200,000 shillings for both myself and my donor.
NHIF currently covers for the actual transplant surgery cost, both for the donor and the recipients. But that is where it ends. The insurance fund covers up to 130,000 shillings for the donor and 500,000 shillings for the kidney recipient, which is only enough for the surgery and admission cost of up to 5 to 7 days, after which one has to pay out of pocket. Even with more than 7 hospitals in the country, including Kenyatta National Hospital, Moi Teaching and Referral Hospital, and other private hospitals being able to do kidney transplants, there are those who still prefer going to other countries, especially India, for treatment, which can easily be found within Kenyan borders.
There's advantage of doing it at home because I'll see my loved ones.
Because of the hiccups in Kenya, we did it. I did mine in India, where my sister donated.
I used 700,000. So NHF paid 400k, and I paid the rest.
Much as NHIF is paying, you have to consider some things like you'll need to see your doctor at some point. That's outside, you'll have to pay, and then maybe transportation like twice per week. Then should anything happen, maybe you're prone to infections, you'll have to go back to hospital, do a set of tests.
And that's another reason why NHIF needs to rethink their current policy of not funding transplant medication, because there will be more people who will be coming on to dialysis, not because the disease is growing, but although it's growing, but because more people are getting to know about dialysis, more people are getting the diagnosis, and there is assistance because dialysis is closer to the people. So in due course, we will have 10,000, 20,000 people on dialysis in this country, and I don't think that NHIF will be able to support that.
To Teresa, Maureen and Samuel, who have done kidney transplant, their taste that life is better off than depending on dialysis, which leaves you worn out after spending hours on the machines, rendering one unproductive.
Apart from the challenge of getting medication, I've had a good time.
On dialysis, you will be in hospital most of the time, and it has a lot of body problems.
Dialysis is just chucking everything from your blood. It's not caring whether it's good or bad. Everything is chucked. So what you do, maybe you take supplements to cover for those minerals that are coming out unwantedly.
We meet Veronica Kongoman from Marsabit County. Her husband just underwent a kidney transplant at Kenyatta Hospital in mid-March this year, and she can attest how kidney transplant has saved her unnecessary costs.
Kila wakati mzee alikuwa anaenda dialysis na tunaamka asubuhi mara 2 kwa wiki, mambo ya transport kwa kila siku.
While NHIF decision to support patients in defraying the upfront costs of surgery is commendable, experts say that the subsequent failure to cater for the long-term costs of immunosuppressant drugs reveals an irrational approach in the transplant program.
The longest patient who I have seen in my practice staying on dialysis did stay for 24 years.
The gains they have made, especially in catering for transplant costs, can easily be erased if the medicines to keep the kidney patients viable are not accessible to those who need it. While the cost of transplant is one thing, the other headache facing kidney patients is getting donors.
For now, we are doing only living-related kidney donation. In time to come, perhaps in our lifetime, maybe the next 5-10 years, our prayer is that we'll be able to get kidneys or to harvest kidneys from deceased persons.
If you have a kidney disease, there is a likelihood that your other members of the family are potential kidney patients. So if that is the same place you are looking for donors, it becomes a bit difficult. For example, in my case, out of 7 siblings, only one could donate. So you can imagine now someone with 2 brothers or 2 sisters or 2 siblings. It becomes more and more difficult. We should relax the rules so that anybody of goodwill can donate.
If the transfusion and organ transplant bill currently in Parliament gets a green light, kidney transplants from deceased donors will be a reality.
What is being proposed is what is called an opt-out mode of organ harvesting. Now, this means that it will be assumed that every Kenyan is an organ donor unless now a Kenyan specifically says, don't harvest my organs.
Kidney patients require a lot of support from family and friends. Apart from the financial support, psychological support is also important, as the disease can take a toll on them and their family members too.
It took a lot of prayers, it took a lot of counseling. I have people that I can call right now and vent to, because at times it gets to me. It really gets to me.
Thank you to everyone who has always come in to help. Hata wengine unakutana nao kwa barabara, they just help you. Wengine wanakupigia simu, my name is who and who, nimekutumia pesa kidogo, nunua dawa. Wengine, are you planning for a fundraiser? We come in. Do you have a donor? Do you have, wanakusaidia. Mashida zile maybe unaona ni mingi kwako, probably they are kidogo kwa watu wengine. Watu wengine they are suffering a lot, and you have everything if you have good health. If you have good health, you have everything you need. You don't need anything else apart from good health. Hiyo ndio itakusaidia kufanya vitu zingine. Wacha kusema una chakula na uko na mikono inafanya kazi.
Kidney disease, whether acute, chronic or end stage, can be extremely costly. Therefore, post-transplant patients need support to ensure they don't lose their kidneys again. Building Walyaula, Kenyan News.